All right, like I said, it's Data Chat, and on today's edition, we're going to be looking at malaria disease. This is going to be taken from our poll. This is the malaria disease poll that was conducted by NOIPolls in 2021. That's what we're going to be focusing on today, and majorly we're going to be looking at malaria disease. We're going to be looking at the impact of primary health centers with regards to managing malaria disease. We also have a guest who will be talking around these issues today. He is Dr. Laz Ude Eze. But before we get to Dr. Laz Ude Eze, we're going to be looking at a poll presentation which will be done by Raphael Mbebu. Raphael is the team lead social research NOIPolls. He's going to be running through some parts of the poll findings, and if you want the full report, you can go to our website on www.noi-polls.com and you'll get the full findings of the poll. It is Data Chat on V106.3 FM, and I am Nelly Ohuche. And this is the findings of the malaria poll. We're going to be looking at it vis-a-vis the health insurance poll. Both polls were conducted in 2021. This is a rundown of the malaria poll by Raphael Mbebu. Stay with us.
Thank you. So, NOIPolls conducted a survey to gauge Nigerians' opinion regarding malaria disease in the country. So, we had asked the respondent, how prevalent do you think malaria disease is in the country? Interestingly, 87% of the respondents said malaria is either prevalent or very prevalent. We have another 11% who said malaria is somewhat prevalent, and only 2% of respondents said malaria is not prevalent at all. So we went further to ask them, what do you do whenever you have symptoms of malaria? So we found that 57% of respondents said they go to hospitals for treatment. 16% said they go to pharmacy shop for treatment. 15% mentioned that they go to chemist shop for treatment. We have 9%, 6%, and 3% who said they either buy drugs themselves or take herbs, respectively. So looking at the analysis by geopolitical zones, we found out that majority of the respondents from the north seems to go to hospitals whenever they fall ill, compared to the southern states of Nigeria. So we have northeast Nigeria with 82% of the respondents who said they actually go to hospital whenever they fall ill. The least region in the country is southwest with 43% who say they go to hospital whenever they fall ill. So we have a similar study that was conducted about the same time on access to health insurance cover. So we had asked Nigerians, do you or any member of your family visit hospitals whenever you fall ill? We have majority of the respondents, 87% who said they actually go to hospitals whenever they fall ill. Only 13% of the respondents said they don't even visit hospital at all. So we went further to ask them again, which health care facility do you or your family member visit whenever you fall ill? We found 71% of respondents who mentioned that they go to public hospitals, and 48% who say they go to private hospitals for treatment. And of those who say they don't even go to hospital at all, we went further to ask them, what do you do whenever you fall ill? Majority of respondents, 44%, say they go to pharmacy for treatment, and 39% say they go to chemists for treatment. 28% mentioned that they actually do self-medications whenever they fall ill, and only 9% say they go to traditional doctors for treatment.
All right, we're still here. That was Raphael Mbebu with the poll presentation, the malaria disease poll presentation. Thank you very much, Raphael. Yes, so like I said, we're going to be looking at malaria disease. We're looking at the impact of primary health care centers in the elimination of malaria, also in the treatment also of or managing of malaria disease. Malaria, like we know, is a global public health hazard, and according to the 2020 World Malaria Report, Nigeria has the highest number of global malaria cases, and this accounted for about 27% of global malaria cases in 2019. and also it accounted for the highest number of deaths, which is about 23% of global malaria deaths. Also, WHO report shows that Nigeria accounted for 31.9% of all malaria deaths worldwide in 2020. That's actually very alarming. 31.9% of all malaria deaths worldwide in 2020. This is actually very alarming. NOIPolls malaria disease poll, which was conducted in 2021, also shows that 83% of Nigerians who visited the hospital in the last 3 months, that was as at the time the data was collected, were diagnosed for malaria. This makes it a major health concern. So on today's edition of Data Chat, we're going to be looking at issues around malaria. Issues around malaria and the impact of public health centers in the treatment and the elimination of malaria disease. That's what we're going to be doing. So in doing that, we are also going to have a phone interaction with Dr. Laz Ude. Dr. Laz Ude is a medical doctor. He's also the CEO, Talk Health Niger. He's the CEO, Talk Health Niger. He's also the convener, Make Our Hospitals Work campaign. Dr. Laz Ude, you are welcome. Hello, are you here, Dr. Laz? Hello, Dr. Laz?
Yes, I can hear you.
Great. Great. It's good to have you here today.
Actually, Dr. Laz Eze is my middle name.
Okay, Dr. Laz Eze, you are welcome on the program.
Thank you.
Okay, so like I said, we're looking at malaria disease. We're looking at it in terms of the impact of malaria, the impact of the primary health care centers in the treatment, in the management, actually, of malaria diseases. So we're going to look at the findings of the poll. The poll findings has actually established the prevalence of malaria disease with an 87% rate, amongst respondents. Why this high rate of malaria disease in Nigeria, despite all of the efforts and the programs we see the government, and a lot of organizations roll out over the years, how come we haven't seen a reduction in the incidence of malaria disease? Dr. Laz.
Yes, thank you very much. Looking at that data, 87% of adult Nigerians that were surveyed, saying that it's quite high, but come positive so that they'll be able to sell anti-malaria drugs.
Okay, so for those who do not sell anti-malaria drugs, why would they want to do that?
Yeah, that's why it's a very bad practice, but it happens. Because we get this feedback from even practitioners themselves who are frustrated by such practices, where people get into some kind of malpractice for the sake of making money. And I do hope that the authorities, various regulatory authorities, the medical profession, will be able to look into this, especially at the state level.
Okay.
So, yes, perception of malaria is high, but in reality, it's not as high as being diagnosed or being treated.
Okay, so if we also look at what you have said, the findings also show that 57% of Nigerians go to the hospital for treatment when they have malaria. So regardless of the prevalence rate, we're saying that those who have malaria or who think they have symptoms of malaria actually go to the hospitals for treatment. That's 57%. 16% go to pharmacies, while 15% visit a chemist, when they have this symptom. This number seems, fair enough. However, the concerns are the 16% and the 15%, respectively, who either visit a pharmacy or who visit a chemist by the roadside. Could this also be because of the absence of a health insurance coverage, considering they have to pay from out of pocket when they visit a pharmacy or a chemist? So why would anybody visit a pharmacist or a chemist when they can go to a hospital and get good, diagnosis? Is it a case of not having, funds to for treatment? Could that be the issue?
Well, industry, but also comparing this data with others like what you see with the National Demographic and Health Survey and all of them. We also see that the population that is sampled, of course, possibly could introduce some bias in their response. Sometimes, that when you come and pose certain questions, they will respond to you based on what they think is the right thing and not really based on the practices. So there is much more access to patent medicine vendors in generality of the country, and people, a lot of evidence shows that more persons tend to go there, and also the primary healthcare facilities, when they have when their body temperature is high. But a lot of times they just go over the counter buy drugs. But it's very encouraging to know that yes, up to 83% of adult Nigerians are saying that in the last 3 months they got diagnosed in a health facility. But I would think that data, perhaps we could look more at that. For health insurance is key. Now the coverage is very low, and also looking at the survey that NOIPolls did November last year, just barely 53% of Nigerian adults who responded, say they are aware of National Health Insurance Scheme. So if just barely half that even aware in the first place, and as much as 89% say they don't know how to go about getting health insurance. It's something of huge concern. The coverage is still very low in many parts of the country. So if more persons are going to hospital to treat malaria, it's definitely not because of health insurance, because they still have to do out of pocket. Over 70%, according to national health accounts, around 76% of healthcare expenditure is still out of pocket. So whether they go to the hospital or they go over the doctor, there's a high chance that in almost 8 out of 10 will have to be out of pocket.
Okay. All right. So, still staying on that health insurance poll, the findings actually show that 71% of the respondents say they visit public hospitals when they or their family members are ill. That's 71% visit public hospital. We also have another 48% that visit private hospital. I mean, this speaks to, to the high level patronage for public health centers. So I would like to know, how much impact has the public health centers had on malaria control? Considering this large number of patronage, the polls show 71%. So how much, impact has this public health centers had on malaria control? Also, what is the cost comparison, for the treatment in both the private and, the public health centers, considering that, government is doing a lot to see that there are public health centers in every nook and cranny and people should be able to access them.
Yes,
so in terms of treatment comparison.
Because public health facilities are cheaper, and given that about 8 out of 10 pay out of pocket in that context, people tend to patronize more when you have easier access, financial access to services. And again, in terms of distribution, public health facilities are also more widely distributed as compared to private hospitals. Even though in terms of the primary healthcare level, you have the patent medicine vendors who they usually call key business, almost at every grassroots level, and they are within the private sector. So, yes, the impact of malaria, with government providing malaria testing and treatment with support of some development partners in public health facilities, that could be helping to drive the demand. And this is more practice in primary health center level, targeting children under 5 years and pregnant women, who are adults.
Okay.
So, that's the cheaper prices of malaria testing and treatment
Okay, now that you have brought up the issue of children and women, I would like us to have a conversation around that. But just before we do that, for those of you who are listening, if you want to reach us to contribute to this program, you can call us on 0817 687 2132. I'll take that number again. 0817 687 2132. You can also reach us on 0817 687 2134. All right, Dr. Laz Ude Eze, we are still here, and like you said, in particular about women and children. When they talk about malaria disease, there's high mortality rate for women, pregnant women especially, then for children below age 5. Why is this? Why is the situation like this? I mean, why are they this vulnerable?
Thank you very much. Because immunity is.
Hello, you still there?
Yes.
All right, so we're listening.
That's right. Have weaker immunity compared to adults. So for children under 5 years, their immunity, they are young and their immunity is still growing. So they are more vulnerable to having severe malaria, which is when the malaria parasite gets so much that it gets to the brain and begins to affect the central nervous system, leading to convulsions and other symptoms that may eventually lead to death if not properly treated. So that has to do with the reason why that the immunity can be, and they also cause of infection and other conditions.
Okay. All right. That explains it. I've been wanting to ask that question for a long time. Okay. Let's also consider effective malaria or effective management of malaria cases in public health centers. And can this actually be compared to the quality of services rendered in the private health facilities? Can we say that the private health facilities would offer better services in terms of management of malaria disease as compared to the public health centers?
Well, if I make such comparisons, it will be based on assumptions. We need specific data to be able to say whether it's better managed in private or in public health facilities. So, but my guess could be that depending on which category of private, there's been effort to train across board, to train patent medicine vendors who are closest to the people, especially in a lot of rural communities. There's also a lot of trainings among primary healthcare providers across the country on proper diagnosis and treatment of malaria. So I'm not sure if similar trainings have been done sufficiently in perhaps secondary level private health facilities, even in public health facilities. So having said that, in terms of practice, my guess would be that you're more likely to get better quality practice in private in some locations and in public in some locations.
Okay.
It has to do with the quality of staff. You may know that in some private PhD providers, you just have people who have no background training in medical science. So they have no license to defend. So no matter the kind of training you give them for 1 week on malaria diagnosis, they'll still do any practice they feel is most convenient for them, driven by either out of convenience or perhaps making some additional money. But when you have more professionals, whether it's public or private, there is a higher chance that the quality of care will be of more standard.
All right. As we wrap up, let's actually also look at how do we improve, say, access to malaria treatment in, let's say, rural communities, especially with respect to accessibility and affordability of malaria medication. How do we improve, I mean, when we go to these places, how do we improve the malaria treatment in these rural, communities? Because sometimes we'll go to some of these rural communities and you find out that they are not sufficient. I wouldn't want to use the word sufficient. There are no qualified health professionals, or they don't even have anyone on ground to attend to you. How do we deal with issues of malaria, considering the fact that we're looking at attaining some level of elimination of malaria or zero malaria, as the case may be? So what do we do for the rural communities in terms of improving treatment?
Yes, I think we start with massive awareness for people to even understand what malaria is. A lot of persons, you may assume that they know what malaria is. As far as a lot of people are concerned, anything that raises their temperature is malaria until proven otherwise. And some people get stressed, and all they just need is to have some rest. They feel a bit weak, and they'll say they have malaria. Some they just have flu, and which can go with or without treatment, and they'll say they have malaria. So with that massive awareness among the public, that will help to influence health behavior. Then number two is availability of the quality delivery of services. Yes, we tell people get tested before treatment, but the test kits, the standard test for malaria is microscopy. Having a microscope where you have a trained scientist, medical laboratory scientist, that's going to look through the microscope to say, yes, I can see Plasmodium falciparum, I can see malaria parasite, so this is malaria. But in the absence of that, there's also the rapid diagnostic test kits, which are also not readily available everywhere. Even when you want to buy it over the counter to even do the test yourself, you may not find it to buy for those who could afford to buy it. So you have different factors that affect this access, because it has to be available in the first place. Next is the cost. So the cost is not affordable to a lot of persons in the population. An average artemisinin combination therapy is over 1,000 naira, and this is like daily wage for some people, especially rural dwellers who do artisan work or manual labor in farms. So you can't let to use their entire daily income just to buy malaria medicine. So it's been subsidized in some cases.
Okay.
We need to do more of that, because most times it's from donor support that is provided. So the government at the state level and at the local government level, and even communities themselves, the community can come and say, in our community, we want every child below age of 5 who is unable to afford malaria treatment, that should be subsidized to let them pay 20% or 30%, wherever they can afford, while the community mobilizes resources to sort out the rest.
All right.
So this thing is about everybody showing concern, because we take malaria as if it's that's common illness there, but it's the number one killer of children. Children under 5 years, something seriously with pneumonia, in Nigeria.
Okay. I like the fact that you say, government and donor agencies should look into the case of subsidizing, for malaria treatment. We're hoping that, even as this is a pre-election year, that this would also form, some campaign, campaign. I mean, we'll ask for our politicians to do the subsidizing for us as part of their campaign strategy to win our hearts in the next dispensation. Okay, finally, in order to identify potential avenues for intervention and to also improve access to malaria treatment, what part of the cost for the treatment of malaria disease in hospital carries the highest burden for consumers? So you talked about subsidizing. I mean, if I were to subsidize, and I want to know, if we have to break it down in terms of what is needed to treat malaria, I mean, which part of it bears the highest burden for a consumer? Is it the point of testing? Is it the drugs? Is it what exactly?
Yeah. Okay, I think the the medication bears disproportionate aspect of the cost. To test is largely cheaper, and the drugs, especially the artemisinin combination therapy drugs, are more expensive. And for those that get severe malaria, it's so much more expensive. Of course, the goal is not to have severe malaria at all. When malaria is diagnosed on time and treated properly with ACT, there shouldn't be a case of severe malaria. But when that occurs, we need intravenous medications, to have that done, plus other supportive treatment, hospital admissions, and all of that. So that makes it even much more expensive. Yes, I'd like to mention about subsidy and even providing it free where possible. Let me also mention that the communities must be involved. I've had cases where, with donor support, I took my uncle to go to primary health center near us to get malaria treatment, to get diagnosed of symptoms of the health condition he had, and possibly be treated with his malaria. So he went there, and I was sure that there's donor support to provide malaria diagnosis and treatment free.
That's interesting.
But when I came around to check on it, they said you should pay 5,000 naira. And the people did not even know that it's supposed to be free. So some health workers, when you make this available to be free, they sell it and put the money in their pocket.
So I guess that's where a lot of sensitization will come in.
Structures that be very much involved, so that they'll be holding health workers and holding themselves accountable as well.
All right, thank you so very much. And we have been looking at the issues of malaria disease in terms of the impact of primary healthcare centers in the management of malaria disease. And we have had Dr. Laz Ude Eze. Dr. Laz Ude Eze is a medical doctor. He is the CEO Talk Health Niger and the convener MakeOurHospitalsWork campaign. Thank you so very much for being a part of this today.
Thank you. Thanks for having me.
All right. All right. This is where we will be wrapping it up for today's edition of Data Chat. We have been looking at malaria disease. Next week, join us. We'll be looking at something a lot more interesting. So it's Data Chat on We 106.3 FM, and I am Nelly Ohuche on behalf of the management of NOIPolls, the production NOIPolls. I want to say have a beautiful, beautiful day.